Good afternoon, Her Excellency, the First Lady of the Republic of the Gambia, Mrs. Fatmata Barrow, Mr. Cisse from AFRICEL, representing both AFRICEL Gambia and AFRICEL Global, Mr. Singade, representing the NCD unit of the Ministry of Health, distinguished guests who've been here earlier than expected. I want to start off by apologizing for keeping you guys waiting, because that's never how we want to set the tone, especially when we talk about a shift in paradigm when it comes to how healthy or lack thereof our nation is. I want to start off today by talking about why we are here. When we started Innovarx Global in 2019, we decided then that the average Gambian had too many obstacles in their way when it came to their health and well-being. Anyone you ask, they'll say obstacles like cost, transportation, location where they live. But what I also found out was the biggest obstacle to our health system was our own selves. Oftentimes they ask not what your nation could do for you, but ask what you could do for your nation. And health awareness is one aspect that we've always mortgaged away to the powers that be. Any Gambian could tell you everything that they think is wrong with the health system. But the same Gambian, if you ask them, when was the last time you woke up and went and checked your blood pressure? When was the last time you decided that 4 teaspoons of sugar is too much for 8 ounces of tea? When was the last time you got off work at 4 o'clock and decided to go for 30 minutes walk on the beach, which is free? The average Gambian does not have a sense of responsibility when it comes to their health. And which is why we're here today. Even our partners in this event, like Walk for Health, like Wally Fitness, these individuals are helping our health system more than arguably any company, including Innovarx Global, is, because they've committed to health and wellness. So when we started the company in 2019, we figured no Gambian will ever have to pay to find out how healthy they are. And if you look at the data, 3 out of 4 deaths, 3 out of 4 when it comes to 10, so about 30 to 40% of the deaths in the Gambia are related to non-communicable diseases. These are diseases that you cannot get by sitting next to somebody. And especially in this day and age of coronavirus, it's a good example to tell people the difference between a communicable disease, like the COVID virus, and a non-communicable disease, like diabetes, hypertension, high cholesterol. So if a nation of 2 million people, almost 40% of our deaths is related to something that we as Gambian peoples could take charge of, there has to be a shift in paradigm. That's why Innovarx Global Health, when we started as a very young company, a lot of people assumed that we were a company that had a lot of money. Because instead of finding profits, we were finding purpose. And we aligned our purpose by democratizing access to basic health care. Which is why since 2019, every single Gambian who's come in contact with Innovarx has not paid one butut to check their blood pressure, has not paid one butut to check their blood sugar, because the company saw that as a sowing seeds into a nation that could be the healthiest nation in Africa. I say that it may sound like hyperbole, like I'm exaggerating, but follow me, let me do some math for you. Our population, 2 million at best. Did you guys know over half of the population is under 25? We're a young population. So from a healthcare standpoint, you're down to 1 million people. 1 million people, if you took analysis, data of 1 million people's high blood pressure level, their diabetes blood sugar level, you could extrapolate what percentage of your population are healthy, at risk, or already have an NCD. It's 1 million people. So if, what's your number? Every Gambian wakes up and they know if they're hypertensive. They know if they have risk of diabetes. Our hospital systems will be less burdened. The Gambia since independence has never been in a place where people are satisfied. But our health ministry, our health system is overburdened because Gambians only have a relationship with healthcare in a time of emergency and a time of crisis. And any health expert would tell you healthcare is not expensive. Healthcare is expensive in a time of crisis and emergency. So if as a nation we commit to health and awareness, if Innovarx, thanks to AfriCell, we're here for 2 days and we're telling the entire Gambia citizenry, come and find out what your status is. And Madam First Lady shared something with me. I think we have a benefit to have a First Lady who's of the people because she's lived the Gambian experience. She's been a mother in the Gambian experience. She's been a wife, a brother, a daughter. She told me this is good, but how do we take this to the grassroots levels and have a bottom-up approach where now our children in our primary schools are learning about diabetes, are learning about hypertension, are learning about the effects of sugar in our diet. Once again, the healthiest nation in Africa is possible. Because if you commit 10 to 20 years to every Gambian knowing more information about diabetes, hypertension, high cholesterol, our population of 2 million people can and will be the healthiest in Africa. I'm going to add a personal anecdote, because most people, they have an uncomfortable relationship with the truth about their health. A lot of people may not get screened today and tomorrow because they are afraid of finding out what already is and will always be. It's like a vehicle. No matter how long you hesitate from opening up the hood, what's there will always be there. I tell people I'm 36 years old and I'm living with hypertension. I'm 36 years old and I've been living with hypertension for 8 years of my life. I got diagnosed when I was 28. I also tell people that know me, know fitness is synonymous with who I am. But I had a grandmother, Aja Fatim Menga of Afdai, who died at 56 years old from diabetes and hypertension. We, as her grandkids, did not get to know who she was because she left too soon. Every Gambian household, there's an Aja Fatim Menga who's the pillar of the family, who never got the opportunity to get to know their grandkids because of non-communicable diseases. So I understood that these diseases also have a genetic component to it, which is important for a lot of Gambians to know. You could do everything right, but by virtue of the cards that God dealt you and your family, you are already at risk. My mother her life is different because of information. She understands the disease and how to control it. She's been blessed to have a son who understands what she needs. I, as one of the siblings, when I found out that I was hypertensive, the first thing I said was Alhamdulillah. Because out of all of my siblings, I am glad that I was the one who had to deal with a non-communicable disease like hypertension. Because knowledge is power. I understood the condition. I knew what I had to do. I knew I could not eat whatever I wanted anymore. I knew I could not afford to not exercise. I knew I could not afford to take my antihypertensive every single day. So if anybody in my family was going to carry the weight or the burden of the disease, I was glad that I was the one and not any one of my siblings who I love dearly. So when it comes to NCDs, knowledge is power. Knowing your status is not a death sentence. If anything, you're giving yourself an opportunity to prolong your life and grow old to be a grandmother or a grandfather who could tell stories to your grandkids. I'm going to end with Africell. A lot of people will ask, why Africell? I always ask them, why not Africell? So there's a synergy with brands. Africell, there's a joke that if you ask them for anything, they tell you yes, as long as they could paint it purple, right? But Africell has had a commitment to nation development that made it easy for us to work with Africell. But the foundation of that relationship is trust. Africell trusted our vision when we came knocking on the door. They've utilized our services and they trusted the quality of our delivery. See, trust is why a lot of companies like Innovarx struggle in our own country. Because oftentimes you have to do twice as much to earn half as much trust. Because individuals who make decisions oftentimes scrutinize people that look like us. So my challenge always to my Innovarx staff is make excellence a way of life. And healthcare in particular, restoring the dignity of Gambians through excellence in service is how we earn the trust of not only Africell, but global partners, the regulators, so that Gambia now could be a country where people have trust in companies like Innovarx to solve our problems. So Africell, I thank you guys for the trust that you have in us. And I want to extend the same olive branch to any institution in the Gambia who's committed to building a healthier Gambia that all of us could benefit from. To my staff, you guys know what I say all the time. Excellence is the status quo. And anybody who experiences Innovarx understands that it's more than a profit-making venture for us. We're here to stay, and we will be partners in creating the healthiest country in Africa in the next 20 years. Thank you very much.